over 25 years, New York City's public hospital system has cared for the poorest and sickest city residents. But with the advent of managed health care plans and the elimination of city support, the system faces an uncertain future. I'm David R. Jones, president of the Community Service Society of New York, welcoming you to the Urban Agenda. As an outgoing board member of the Health and Hospitals Corporation, I have seen how the system operates and what it needs to do to survive. Here today to give her prescription on how to keep the public hospital system alive is veteran health advocate Judy Wessler, who serves as policy coordinator for the Commission on the Public Health System. Judy, tell us, public health, I don't even know if it's on anyone's radar screen sometime, at least if you read some of the newspapers in the city. How do you see the public health system, HHC, Health and Hospitals Corporation, evolving? What's going to happen?
Well, one thing before I start is that it will be a tremendous loss not to have you on the HHC board anymore. I think you added a human dimension that will be very missed. So, but thank you for the time that you served. I didn't.
This fight
I didn't say that to embarrass you.
Yes, this fight is just still going to be held.
Yes.
But tell us, what do you think?
Public health in this city is in really serious trouble from a couple of different perspectives. The Health and Hospitals Corporation has been like the whipping boy, for the mayor. He claims credit for doing wonderful things and steps away when there are problems. And so many of the problems are really being shoveled under the rug and not addressed, as has happened, unfortunately, in other city agencies, at a time when HHC should be getting ready for managed care. They're doing things to get ready, but those efforts are, I think, wrong-headed in a lot of ways. And one example is the Health and Hospitals Corporation runs 6 large diagnostic and treatment centers, which are ambulatory care facilities, and they're in communities of great need. They provide tremendous services, and they do it in a very culturally and language competent way, which is what we need. We need more of that. Their budgets are being stripped. There are proposals to consolidate services in a way which we think will be very, very harmful. And yet this should be the base for managed care in those communities. They're often the only providers, but the finances have, they've put blinders on, and let's cut. Right. So the services and the importance of them and what they mean to providing care get lost in that.
I think part of the public really doesn't understand in many respects what public hospitals do. I think the mayor was rather successful in arguing with people that it's best to privatize these institutions because there's no need for it. We have an insurance plan for under Medicaid and Medicare. Why should you have a public hospital system? If I'm sick, why should I go to a public hospital? What are the arguments to sustain this unique system in New York?
Well, a couple of things. One is that a lot of people with Medicaid choose to go to the public hospitals, even though allegedly it's a gold card and they could go any place. But secondly, we have a growing number of people without health insurance in New York City. 27.8%, and I'll figure statistics, but 1.8 million people in 1996, and it's probably gone up since then, had no health insurance. So almost a quarter of the population, more than a quarter of the population under the age of 65 have no health insurance. These are not rich people. They're not people who can take out of their pocket, and go and buy care. And the public system is the only system that, besides some community health centers, which are also very important, that has the mandate and the mission to serve everyone regardless of the ability to pay.
I think most people have the view that if they turn up sick at a voluntary hospital, they have to be seen. Is that true?
Only in an emergency.
And what would that mean? Say I've got no insurance and I show up at a private or voluntary. What happens to me?
Well, you're bleeding to death, as opposed to you're pretty sick, but you're not dying. There's federal and state laws that require that voluntary hospital to look at you and determine how sick you are. If you're very ill, then they have to make arrangements for you. If you're not very ill, if you're not in the emergency category, they can tell you to go home or send you someplace else, to a public hospital usually.
So basically, if I had something like renal failure, they wouldn't take me.
Well, with renal failure, you could die, so that's a different category.
Right.
But what they're required to do is to get you a little bit better and then decide whether they're going to admit you at their hospital or transfer you, as we call it, dump you, to a public hospital. They're supposed to get the permission of the public hospital to transfer you, but that doesn't always happen, and so people are sent in ambulances to a public hospital.
Now, there are a lot of uninsured people, as you've said. Is the new welfare time limits going to have any impact on how many people are going to come out?
And not only welfare time limits, but also the immigration changes. You know, we have a large immigrant population in New York City and more people coming in. The changes as they stand right now, a lot of people will not be eligible for Medicaid, and people who lose their public assistance also could lose Medicaid. So these numbers now, and this is before those laws take effect, that, you know, more than 25% of the population have no health insurance. After those laws, we have no idea how bad.
I think it helps to tell our audience just what this could mean. Even the simplest surgical procedure, appendicitis or ruptured appendix, can cost well into the tens of thousands of dollars. Without insurance, no one, very few people actually, other than the very middle class, would have that kind of cash lying around. So this could be not only critical for a homeless person, this could be critical for somebody who's working 2 or 3 jobs, who doesn't have a spare set of money around or any assets. So we're facing it. Where, by the way, is the privatization move going?
Stopped, thanks to you and others. Yes.
And you?
Yes. There was lots of community activity. There was lawsuits. There were elected officials got involved. There was a lot of good things that happened to stop the mayor. He tried to privatize Coney Island Hospital as the first. He went beyond the bounds by bringing in a for-profit company from another state.
Which hasn't been seen in New York for 20 years? I think
oh,
we've had a for-profit.
I think even longer, yeah. He was stopped in the courts, and city council got involved. Right. There was a joint lawsuit. It's been appealed and appealed, and every step of the different courts in New York State he's been stopped, but he won't stop. So he's now at his very last opportunity, and has appealed once again.
There's some of us on the board, and obviously we've discussed this with you, saying it really doesn't matter if he wins on privatization, if he keeps starving the public hospital system of money, that it'll collapse on its own. As it's my understanding that the public hospital system has been stripped of almost $350 million in former subsidy that was underneath. Though as he strips the money away, he says he's improving quality. I saw that, you know, for the first time, HHC has all its hospitals fully approved by the accrediting policy. The books are in balance. What's the problem here?
Well, the books are not in balance, unless you count the fact that they have not laid off, but taken other measures to reduce the number of staff. And actually, right now, it is rumored very strongly that there will be 1,500 people on staff at HHC who will lose their jobs. They will be pink-slipped. They've done the early retirement, they've done buyouts, they've done all these tactics, and now supposedly there will be 1,500 layoffs. The city is supposed to be making up what HHC doesn't get from other sources when they provide care. And this is required, but the mayor just flaunts the law, and he hasn't been doing that. So that now, less than 2% of the HHC budget comes from the city, where it used to be more than 10%, now less than 2% does. So they balance the books by just cutting staff, reducing services, making it harder for people to get access to services, and and they have not improved quality. As a matter of fact, there are serious problems in the number of the facilities. If you accept the Joint Commission accreditation as quality, then I have serious problems with that. There are real serious questions about what Joint Commission actually measures. So having that accreditation, although it's important to have, and we're very pleased that all of the facilities are accredited, because otherwise they could lose federal dollars.
Right.
But it's not an indication of quality. Absolutely not.
Okay, what do you see in terms, everyone admits that the HHC system had to rationalize its service, and there's something called overbedding, the issue of having too many beds in the system. Clearly HHC has made some strides there, but you also mentioned how HHC is going to fare in a new managed care environment, particularly as first Medicaid and potentially Medicare patients are swept into HMOs. What do you see this portending for HHC?
I think for a while they're going to lose a lot of their Medicaid patients. Right. There are a lot of private HMOs, for-profit HMOs that have a lot of money to do advertising. They're seductive, and they will probably take some of the Medicaid patients away from HHC, again, for a time. As we've seen right now, 2 for-profit HMOs are starting to drop out of the Medicaid business because it's not making enough of a profit for them. So, patients may come back, but by that time, there will probably be tremendous losses in the dollars. HHC will have to, and thank God, continue to see the uninsured, but Medicaid dollars have helped make up some of the, quote, losses from serving people who don't have health insurance. Right. Without those Medicaid dollars, we'll see if we allow it, and we have to fight this, we'll see further cuts, further closings, further reductions in services, and probably further loss in jobs, now, unless we can fight it together.
Now, it's interesting. There is something that's called the bad debt and charity pool. In other words, when an uninsured shows up at a health and hospitals facility or a voluntary hospital or even a private hospital, and they don't have insurance, but they get treatment, they're reimbursed by the state. Why shouldn't that cover the costs here?
It's capped. The total dollar amount that HHC can get at this moment from that pool is it's capped. They can't get any more, and they've gone way above providing care. There was one study that showed that, let me see my figures here, that over 40% of new patients coming into HHC have no health insurance.
At all?
At all.
And these, I assume, are not rich people.
Yes, that's correct. That's correct. So they can't pay can't pay a full bill. They pay a portion of the bill.
Right.
They can't pay the full bill out of pocket, and so the facilities are serving more people without health insurance, and yet the money that they can draw down at this particular time from what we call charity care pools at the state level, there's a total level, and they can't go beyond that. There is an effort now to raise that cap and say that HHC could get more state dollars from that pool and more matching federal dollars. But until that happens, it's a serious problem. But the city is required. It's actually required to make up the difference. HHC, because the board is, as you know too well, controlled by the mayor, and therefore the staff of HHC is controlled by the mayor, and the chair is an employee of the mayor, they don't fight this. So if it doesn't come from outside, pointing up these issues and saying, you can't do this, you have a responsibility to make up the difference if you can't get the state and federal money. It's our job to do that, and we are doing it, but at this point we have not been successful, as yet. that doesn't mean we're going to stop.
What is the relationship between the public hospital system and the voluntary hospital, teaching hospitals? Some of the viewers don't know that basically, in some respects, these aren't even separate institutions. I mean, this is not Columbia Presbyterian being on one hand and a public hospital. They are literally joined in staffs.
To a certain extent,
Right.
yeah. Using the example that you brought up, Columbia Presbyterian actually has a contract where they get paid to provide a lot of the doctors and other staff at Harlem Hospital, which is a public hospital.
Right.
Presbyterian being a not-for-profit voluntary institution. And so they provide the doctors until recent times. Actually, there's been some positive changes
Right.
in the affiliation contracts. Until recent times, the voluntary medical center would decide what services would be provided, in what numbers, and how. And now, actually, finally, Health and Hospitals Corporation has stood up. I must say something good about what Dr. Marcos has done. And said, wait a minute, these are our hospitals and it's our money that we're paying you, so we will be involved in deciding this. And that has started to happen. But the staff, there's a lot of crossover in staff. But a lot of the affiliated institutions are getting patients from the public hospitals. They're draining away patients as well. And I can assure you, it's not the uninsured patients. It's the Medicaid patients where they expect they'll get paid.
Let's talk about another part of the forest in terms of public health, and that's the recent merger that the mayor is putting in place of the Department of Health and Mental Health. I've heard some concerns about what this portends. Maybe I know your groups have been active in this issue.
Yes, and let me say, proposed merger.
Proposed merger, I think.
The mayor, as is his way, is acting as if he has by right the right to do this. But the city council actually has a say. This requires a city charter change, and so the mayor can't do it by himself. It's actually also the city council. City council is supposed to get a plan, work on it for 90 days, and then agree or not agree to the merger. There's been no plan submitted.
By the city?
By the city. There's been
So
absolutely no plan. All there is 2 lines in the mayor's State of the City address that he intends to do this merger.
But they're already doing this.
Well, yes, they are. Like I said, there is a behavior of the royal we. You know, we said it, so we will do it. But
staffs are being laid off, commissioners are being removed.
That's correct. That's correct.
But it hasn't been approved yet.
It has not been approved, and as a matter of fact, more and more people are raising serious concerns about it. The commission has raised, we did a 3-page letter to the city council raising a great deal of concern about, we didn't say don't do this, but we did say please look at these issues. Please do this in a public process, hold public hearings, and we understand now that they will be holding, the city council will be holding public hearings, and we hope that all your listeners get involved in that. There's a lot at stake. In the Department of Public Health, there are critical services like AIDS testing, like tuberculosis, which we just got under control. You know, we can't afford to lose that control. There are services for pregnant women to help them get into care and to make sure that they have a healthy baby. There's lead paint testing. There are many, many services like that that are directly provided by the health department. We're concerned because there's already an example of services being transferred from the health department to the Health and Hospitals Corporation, and the commission has been very active on this. The child health clinics, which have been around for 90 years, and I understand that CSS was
we founded them.
Involved in starting, exactly. They've been around for 90 years. They used to be called Well Baby Clinics, and most people that we talk with know that name. And they provide care free of charge to low-income children around the city. There are 39 child health clinics. 60% of the children who use the clinics have no health insurance. 59% live in immigrant families. We're talking about a lot of children. So the mayor transferred, actually this happened under the former administration,
Right.
transferred those services along with others to the Health and Hospitals Corporation with a contract. And with that contract went city and state dollars, and that was okay. And the services were centrally run, and they basically continued to provide care.
So
At the end of the contract, the mayor said to the Health and Hospitals Corporation, now you take the money, I'm not giving you any more money, I'm taking away the $10 million that the city is giving you and the $4 million that the state matches, and you take the money out of your budget and you provide this care.
For free, out of the
HHC budget, and the HHC budget was already being cut. And so
there was
a
no
lot of
protest.
us, well, there was protest.
not on the the board.
Not
did
on the board. The
Right.
board didn't, I don't know what the board did. But
Right.
anyway, but we went to work, and a lot of children's health advocates were very concerned about
Right.
this. And actually, the city council, 2 years in a row, has restored the money for these clinics. They understand the need for these services. There's a general lack of understanding of public health and what public health needs are in the city at the executive branch level.
It's interesting. Yeah, it's interesting from my perspective, because now we're moving so many people, 400,000 people, from welfare to work, without a recognition that if you don't have health care protection for these individuals, this can't work.
That's right.
But again, they want the work part, but they don't want to do the wellness part.
That's
that
right.
makes someone viable.
That's right.
So these are extraordinary times to be through.
So we are very concerned about the child health clinics right now. There are all sorts of proposals because they're being moved out
Right.
to be run by the hospitals, and hospital administrators probably do a good job with hospitals, but not with small
these.
clinics in communities. So we're afraid we're going to lose child health clinics. We're afraid they're going to start charging. We're afraid they're going to add adult services in these small spaces
Right.
that are really set up to take care of children. So there's a whole organizing effort to make sure that these things don't happen. But just, if I may,
Sure.
the example of what happened with the child health clinics is very well what could happen if the Department of Health merges and starts to get out of providing direct
Direct care.
services. And that's what we're very concerned about.
How would we go about fixing the board of HHC?
Oh, yes. What a need.
You know, this is not only Mayor Giuliani's issue. This was an issue that stretches back right from the beginning.
Yes.
As to the fact that really the mayor has such predominant control over HHC, so it's really not an independent and self-standing body. How do we start to break it free and make it a self-standing and autonomous that fights just for health care?
Right. Actually, the commission came up with a number of proposals. The city council has actually adopted a lot of those proposals.
Right.
And there was an assembly bill at the state level, not the Senate yet. But basically, it would change who appoints members of the board of directors. And we've got to break the stranglehold by the mayor. 10 of the 16 members of the board are either employees of the mayor or are appointed by the mayor. And then, because they have the majority, they then appoint the president, who actually runs day-to-day operations. So as long as that's true, there will be a stranglehold. This bill that we need support for at the state level actually would allow some appointments by state-level people, would allow some appointments by the mayor, some appointments by the city council, and would actually add a community board person, a consumer from the community to add that additional voice. Actually, the commission is just, if I might put in a plug.
Well, first of all, I'd like you to explain to our viewers what the commission is
Yes.
and how it got started, and then I know you have a recent publication you want
Yes.
to talk.
The commission got started in 1991 when the former mayor, Mayor Dinkins, appointed an official commission called the Barron-Desk Commission to look at the public hospital system. And we were convinced that that commission was going to recommend privatization. And so a lot of people who had done a lot of work together over the years sat down at a table and said, we need to do something about this. And so that was the birth of the commission. And actually, we smoked out the official commission, by holding community hearings, they decided that they also had to go out into the community, because before that they were inviting people in behind closed doors to just talk to them. And actually the report they came out with was quite good, and was very supportive of the public system. So we have continued to work. We have a major focus of concern about the public system and stopping the privatization, but also how to strengthen the public system. And so we work with a lot of community organizations. We are a citywide health advocacy organization, but we work with a lot of local community organizations. And we're very pleased that we got funding from Robert Wood Johnson and the New York Community Trust, and just finished a project. And this is the pretty colored book called Away from the Marketplace. We spent a year interviewing people, including yourself, and came up with what we think are very major recommendations, including some very specifically about the Health and Hospitals Corporation and what needs to change, what needs to be done to get more insurance for people, and what needs to change with safety net providers.
How can people get copies of this?
212-749-1227. Again, the name of the report is Away from the Marketplace. And we are very happy and want people to join us in these recommendations. The Commission doesn't do this alone, and we know we will have your support, and we appreciate it.
There's a saying that those who don't learn from history are doomed to repeat its mistakes. New York City has already lived through periods without adequate health care, when children in tenements coughed themselves to death of tuberculosis, and adult workers died of complications from crushed limbs. This is a city with 7 million reasons to have a viable public hospital system. Without it, not only uninsured workers and new immigrants are at risk, but the rest of us as well would face the epidemics and plagues that swept through our city in earlier times. I'm David R. Jones. Thank you for joining us for the Urban Agenda.
To comment on the Urban Agenda or for more information on CSS, contact Community Service Society of New York, 105 East 22nd Street, New York, New York, 10010. Area code 212-254-8900.